May adlaw na tong tanan. What if you can fix your knee pain? Would you do it? Well, I got you. In this video, we will be doing exercises that will help you manage and stop that knee pain. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. Knee pain is very annoying, and it will stop you from doing your self-care, your everyday tasks, and including having fun. So, if you feel any knee pain, please try to see your doctor and get an x-ray. Once your doctor ruled out any medical condition, then please do your exercises and follow along in this video. And if you are ready, let's get started. Before we get started, try to rate your pain scale of your knee from 0 to 10, with 10 being really painful, like your first breakup. Just kidding. Anyway, now that you know your pain scale or how painful your knee is, let's start with the activities, okay, and the exercises. The first one is knee mobilization. So just try to keep your knee relaxed and straight and find your kneecap. Mobilize it up and down, all right? So just up and down, about 10 seconds, all right? Just go gentle and slow and side to side, okay? That kneecap should move, right? Now, if it moves too much and if you feel any clicking or if the pain exacerbates, again, try to see your doctor and ask what's going on with your knee, and he will advise you to get an x-ray, okay? So that's the first one, which is knee mobilization. Second exercise is quad set. Put a roll of towel under your knee, but if your towel is not thick enough, try to double or use 2 towels to make that roll of towel thicker, okay? So what you want to do is to put it under your knee and try to push that towel down with the back of your knee. So you should see your quad muscles contract, right? And try to bring your toes up as well to really maximize that strengthening part. All right, and then try to hold it for at least 10 seconds and release, okay? Let's do that one more time. Push down, 10 seconds, all right? And release. Push it down again and that is your quad set. Okay, third exercise is the short arc quad. Okay, so you're just going to kick up and bring it back down, holding for 10 seconds. Okay, prop yourself up with your hands or your elbows if it was too painful for your wrists. Okay, so this is the short arc quad. All right, still have a towel under you and point your toes up and kick up like this. Hold it for 10 seconds, all right?
Let's go.
And down, up. And one more. And that is your short arc quad. Fourth exercise is straight leg raising, just like this, all right? So straight leg raising, so assume the first position, which is the quad set, pushing the back of your knee downwards to the floor or on your bed. If you are on your bed, you can do this on your bed too. You don't have to be on the floor or on a mat, okay? So what you want to do is to just point your toes up and bring your knee down, pushing downwards, and then kick up. All right? Support yourself with your elbows. If you are on your wrist and that was too painful, be on your elbows like this and kick up and bring it back down. All right, let's try to do 10, but slow. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that is your straight leg raising. The fifth exercise is knee clamps. All right, so since my affected leg is my left leg, I'm on my right side, resting on my right side. Bring your hip forward and keep your feet together like this. All right, you're just going to open and close your knees just like this. Go slow and make sure that your hip does not roll backwards like this. Just keep yourself to your side and open and close. That's why I'm putting my hand on my hip to make sure that I don't roll back like that. Okay, so let's try to do 10 of these knee clamps. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that is your knee clamp. And the last exercise is knees over toes. Alright, so what you want to do is to put your affected leg forward and try to keep your knee as straight as possible towards your toes. So that when you bend your knee like this, you're not going to see your toes if you're looking down at it, and then bring it back straight. All right, so again, keep your leg as straight as possible. Try to follow a straight line with your knee going towards your toes and bring it back. All right, so we're going to do 10 of these. And 1, bring it back, go slow. 2, and if you need support, put a chair in front of you, okay? 3, or use a walker. 4, 5, 6, 7, 8, 9, and one more time, 10. And that is your knees over toes. Alright, so how does your knee feel now? Is it still as painful as your first breakup? Okay, just kidding. So if it is still painful, is it lesser now? Is it lesser than what your rating scale was a while ago? And if it is, try to do this again tomorrow. And if it subsides some more, continue doing this, alright? And if you find this video helpful, please click on that subscribe button, give it a thumbs up, and click on that notification bell as well. Alright? And just a reminder, consistency is the key and never give up. Till next time, paalam!